Chiropractic and osteopathy are two of the most talked about holistic therapies in the horse world, but also two of the most misunderstood. Some people swear by them, others are quite skeptical, and many owners use them without really knowing what they do, how they work, or when they actually make a difference. In this episode, I'm going to pull these two disciplines out of the mystery. I'll explain what they are designed to address, what kinds of problems they are truly good for, realistic results look like, and how to know whether they belong in your horse's program. By the end, you'll have a much clearer way to decide when these therapies are worth your time, your money, and your trust. Today, I want to talk about two disciplines that often get mentioned in holistic horse care, but are not always well understood. The first one is osteopathy, and the second is chiropractic. These are approaches many horse owners consider when something just feels off in their horse's body, when movement is inconsistent, or when traditional imaging doesn't explain what they're seeing or feeling. My goal here is not to promote either, but to give you a clear foundation for what they are, why someone might use them, how they work, and what kind of results are realistic to expect. At their core, both osteopathy and chiropractic are based on a simple idea. Structure and function are inseparable. The way bones, joints, fascia, and soft tissue are organized directly influence how the nervous system works, how muscles fire, how force is distributed, and how the body protects itself after injury or strain. When that organization is disrupted, even subtly, the body often compensates in ways that create pain, asymmetry, reduced performance, or even behavioral changes. So let's start with chiropractic. Chiropractic focuses primarily on the joints of the spine and the limbs, and how restrictions in those joints affect the nervous system. The central assumption is that when a joint loses its normal motion, it alters sensory input to the spinal cord and the brain, which in turn alters muscle tone, coordination, and pain processing. A chiropractic adjustment is a precise, high velocity, but low amplitude movement designed to restore normal joint motion and function and reset abnormal reflex patterns. So why would someone use chiropractic for their horse? Why would you consider using it for your horse? Most often it's used for issues like stiffness, asymmetry, difficult bending, uneven stride, resistance to the contact, or recurrent problems that don't resolve with conditioning alone. Chiropractic is particularly useful when a problem appears to be mechanical and segmented. For example, a thoracic restriction that changes forelimb coordination, or a lumbosacral restriction that alters hind limb engagement. So how does it work? Mechanically, the adjustment briefly moves the joint through its restricted range. Neurologically, it strongly stimulates joint mechanoreceptors, which can rapidly change spinal reflex activity, muscle tone, and pain modulation. In simple terms, chiropractic often produces fast changes in joint motion and reflex control. So what does that mean? So what results should you expect? When it works well, what would you see? You would see immediate changes in range of motion. You would see improved symmetry in movement and posture. You would see a softer top line tone. You would see improved coordination and short-term improvement in comfort. But here's an important boundary, that chiropractic is not a treatment for tissue injury. It does not heal tendons, ligaments, cartilage, or bone. It changes how the nervous system is controlling the joints. For lasting results, the new movement pattern must be supported by appropriate training, conditioning, and management, and even other bodywork. You'll hear often where chiropractors will want the horse to receive acupuncture or other body work to help hold what they've just done. Otherwise, the restriction will return. So, in contrast, but also in similarity, let's talk about osteopathy, which is a broader and in many ways more system-based discipline. So, osteopathy works from the principle that the body is self-regulating, it's self-organizing, and it's a system. And that restrictions in mobility, whether in the joints, the fascia, the visceral, or the cranial structures, interfere with circulation, nervous system function, and overall regulation. Where chiropractic is often joint specific, osteopathy is often global and integrative. An osteopath may work with spinal and limb joints, myofascial planes, visceral mobility, diaphragmatic motion, and craniosacral rhythms. The goal is not to simply move a joint, but to restore coordinated motion between systems. So why would you use osteopathy for your horse? Many times it's used for more complex or persistent patterns. So if you have a horse with chronic asymmetry or recurrent soft tissue strain, post-surgical compensations, unresolved trauma, coordination problems, or poor recovery after an injury. Osteopathy is especially useful when the problem does not localize cleanly to a single joint, but seems to involve global organization and global regulation throughout the entire system or throughout the entire body. So how does osteopathy work? Much of osteopathic work uses gentle, sustained contact to influence. So very different from chiropractic. And it's trying to influence the fascial tone, the autonomic balance, major motor programs, fluid dynamics, and tissue mobility. So rather than forcing change, osteopathy can aim to change the state of the nervous system so the body reorganizes itself. In this way, it overlaps strongly with the modern concepts of neuroplasticity, fascial remodeling, and autonomic regulation. So what results would you expect from osteopathy if you called in an osteopath and actually got them to work on your horse? You would typically see improved postural organization, smoother coordination, reduced guarding overall, and a better tolerance for training. You would see improved recovery and sometimes slower but more durable change. So osteopathy tends to produce system-level changes, not just local ones. Now, I feel that chiropractic can have these system-level changes as well because nothing is done in isolation in the body. But I think the concentration on chiropractic is more specific, where the concentration on osteopathy is more systemic. So here's an important point, though, because I think a lot of times people don't quite realize this as much as they should, that neither chiropractic nor osteopathy can replace a proper veterinary diagnosis or even imaging when it's needed. Do not replace appropriate loading and conditioning in your training. Obviously, do not replace good hoof care, good nutrition, or just overall management. So both of these are organizing therapies. They're not curing therapies. I think they work best when the primary problem is functional, not necessarily structural. So obviously, if you have a horse with an injury to a tendon or some joint abnormality, you need to look at the structure and have the veterinarian work on healing that structure. And oftentimes you don't want to call in a chiropractor if you're dealing with an issue where the mobilization will create destabilization in the area. I think they also work best when the tissue is still plastic, so it's still movable. They work when the nervous system is the major driver and that the environment supports the new pattern. I feel that's really important. A lot of times practitioners are called in and what they have to overcome is more than just what meets the eye, because it is other parts in the system that aren't functioning well for the horse's best interest. So they work poorly when there's an advanced joint disease. And you'll even see vets say, hey, I don't want you to have chiropractic done on this horse because of this advanced joint disease. Or if there's a fibrosis and it's very fixed, or there's a ligament strain, or if there's a major ligament problem, or if there's unstableness somewhere, especially if there's a fracture, or when training and management continue to overload and create the same pattern. So it does no good to have them come in and do work if you're not going to modify the way that you're training and using the horse so that they can stay within their capacity. So why would someone include these in a holistic program? And that's because many equine problems are just not purely mechanical and they're not purely medical. They are problems of organization. There are problems of how the force is moving through the body, how the body is holding a protection, or how the body is compensating, sometimes needed and sometimes just out of habit, or how the nervous system is choosing one pattern over another. So chiropractic tends to be powerful for segmented joint control and rapid changes in motion, and osteopathy tends to be powerful for global integration, regulation, and long-term reorganization. But neither is magic, neither is a shortcut, and both are tools that when used thoughtfully can change how the horse uses its body. The final principle I want to leave you with this is these are therapies that are not about fixing horses. They are about removing barriers so the horse can fix itself. And that is the foundation of truly holistic medicine. But if you've been listening to this foundation series on this podcast, you might be asking the question, well, how is this different from myofascial release? So especially, how is osteopathy different than myofascial release? Because it sounds like there's a lot of overlap. And the simple distinction is this, that myofascial release is organized around changing tissue properties, and osteopathy is organized around restoring system-level coordination. When people compare osteopathy and myofascial release, the key difference lies in what each discipline is organized around. Myofascial release is primarily a tissue-centered approach. The practitioner looks for restrictions, sensitivity, or loss of glide within the fascial system and apply sustained stretch or shear with the goal of changing the mechanical properties of the tissue itself. Of course, if you're looking at needling in any way, shape, or form, you're still changing the mechanical properties of the tissue through needling. The main question is whether the fascia can soften, lengthen, and move more freely. Osteopathy, in contrast, is organized around system-level coordination rather than tissue change alone. An osteopath is less focused on releasing a specific restriction and more focused on how motion, circulation, nervous system regulation, and coordination between regions are working together. Fascia is one of the several entry points, but the central goal is to restore integrated motion and self-regulation across the whole body. In simple terms, myofascial release aims to change the tissue. Osteopathy aims to change how the body as a system is organizing itself, with tissue changes as a secondary result. Now, the next question most of you are having is then, what is the difference between what I do and what an osteopath does? So if you know me personally, you're going to know that there's a lot of overlap in what I do, but I'm not an osteopath. So what I have found is that osteopaths do osteopathy based on their system of manual therapy and neuromuscular regulation. On the other hand, someone who practices like me is using nutrition, herbs, digestion, nervous system development, trauma, learning principles, management, biomechanics, fascia, and Chinese medicine. So neither is better than the other. They are just different. Our historical models are different. Our process is different. Our primary goal is different, and our organizing framework is different. So simply put, osteopathy and chiropractic is a discipline, but my work is a systemic medicine. My foundation is Chinese medicine, and that is a whole system of medicine that takes into account things like organ function, brain and nervous system regulation, structure and movement, digestion and metabolism, emotions and behavior, environment and management, and the way the body adapts over time as an integrated whole. So it's not just a discipline. You may think that acupuncture is more of a discipline, but because it's founded in Chinese medicine, it also has all the characteristics of above. And not a lot of people understand that well enough. So I just wanted to help clarify that in everyone's mind. This is something that many people don't quite understand since the processes of Chinese medicine are still foreign to many. I see people interchanging acupuncture, myofascial release, chiropractic care, and osteopathy, and they're not really interchangeable. You can and should use many of these. So the work that I do and the work of osteopathy may work with similar tissues and similar mechanisms. We work from totally different organizing questions. Osteopathy is primarily organized around restoring mobility and tissue motion. My work is organized around how force, regulation, and capacity determine the nervous system's control of the body. Mobility is one of the outcomes, but it's not the primary target. So I hope that makes it a little bit more clear. What I do overlaps with osteopathy in terms of gentle regulatory work, but I'm not practicing osteopathy. I'm working from a systems-based framework that integrates the biomechanics and the fascia and the nervous system regulation, but also nutrition and management and Chinese medicine. My primary question is not what is restricted, but what is going on throughout multiple systems, what is in dysfunction, and why. Okay, so back to our subject of today. I just wanted to kind of answer some of those questions because I know they came up for me and I know this really well, so I figured they would come up for you. So what would a typical treatment look like if you were to call a chiropractor or an osteopath in to work on your horse? So a typical chiropractic treatment for a horse is focused, structured, and very joint-centered. The practitioner begins by observing posture and movement, then palpates the spine and the limbs to identify joints that have lost normal function or lost normal motion. Treatment usually involves a small number of precise adjustments, each delivered as a quick, controlled thrust to a specific joint. These adjustments are designed to restore normal joint play and reset abnormal reflex patterns between the joint and the nervous system. So sessions are often relatively brief compared to osteopathy. When chiropractic is effective, owners may notice immediate changes in the range of motion, immediate changes in symmetry, stride quality, or even the willingness to bend and engage. Chiropractic treatments tend to be discrete events followed by reassessment and ideally appropriate exercises or training to help the new motion pattern hold. What would a typical treatment be from an osteopath? So an osteopathic treatment usually looks quite different. Sessions are typically longer, slower, and more global in nature. An osteopath may assess not only the spine and limbs, but also the rib cage, the diaphragm, the abdomen, cranial structures, and overall coordination between different regions. Treatment often uses gentle, sustained contact rather than quick thrust, with the practitioner waiting for changes in tissue tone, motion, and rhythm, and are looking for them to emerge. The goal is less about correcting a single joint and more about restoring coordinated motion, circulation, autonomic balance, and integration across systems. Changes from osteopathy may appear more gradual, but can be more widespread, such as an improved posture or smoother coordination, better recovery, and improved tolerance of training over time. In the future, I'll bring in guests who practice these disciplines, so we can explore how they work clinically, how they decide what to treat, and how they integrate this with training, rehabilitation, and veterinary care. I'm sure they'll be better at articulating this themselves. Okay, that's it for today, guys. Thanks again for watching. I'll see you next time.